Assalamu alaikum, ladies and gentlemen. This is Dr. Faisal Mamsa here with you. Today, once again, we are going to talk about a very interesting topic, which is sexual problems in Pakistani males. The reason I'm saying Pakistani males is because I have done a research and I've asked people who are basically based in Pakistan, not in any other country. How does it arise? And if possible, if we have time, we are going to talk about how to treat it. This video will be divided into two parts, which is part 1 and part 2, because it might require a little bit of detail describing it. Well, the most common sexual problem is erectile dysfunction, or in common terms, we call it impotence. So what is the definition of erectile dysfunction or impotence? Basically, the definition involves marked difficulty in obtaining an erection. Number 1. Number 2, marked difficulty in continuing or sustaining the erection. Number 3, marked difficulty in completing sexual intercourse. So all these three things are there and they can be taken as the diagnosing criteria of erectile dysfunction. Now, what causes ED? There are multiple reasons and there are multiple causes that are there that can make a person develop ED. If there is something wrong with our body, that is one. And the other one is if there is a psychological problem that can cause ED. So number 1, let's talk about the physiological or the physical thing. Number 1 thing that has been noted is if there has been any trauma, if there is any injury in that part, as a result of which the blood flow is not adequate, that causes ED. Number 2, anything that has caused damage in that area. But you know, that damage that I'm talking about is a physical damage. It's not about what you have done in early part of your life, because a lot of Maulanas and a lot of gym trainers will be telling you that if you have ED or if you're impotent, then this is the cause. No, this is not the cause. Let me assure you. Then what else is there? Using drugs. Yep. Any form of drugs can cause ED. So don't tell me that no, this form of drug increases the sex drive or not. No. Any form of recreational drugs. Then medications. There are certain medications that can cause erectile dysfunction, and we need to watch before what we are taking. Then you know, any illness, like let's say infection to that area, let's say infection of prostate, infection of bladder, these things, any form of infection can lead to developing erectile dysfunction. We need to see that as far as ED is concerned, is it mild, is it moderate, or is it severe? Number 2, is it temporary or is it permanent? Because if it is temporary, then whatever that has been the cause, that will make it go away. Then, is it related to a specific partner or is it related to any partner? We need to take an account into all these things. You see, the most common psychological factor that is there is basically performance anxiety, and that has been seen in a lot of cases who get into an arranged marriage. They have a performance anxiety because they are expected to perform during the first night, and because the anxiety going high, because the girl have different expectations. But in a lot of cases, what also happens is that initially something happens, most probably anxiety, that can cause ED. Now that ED or impotence can send a feedback mechanism to our brain that it won't happen next time. And if it doesn't happen next time, then that concept is reinforced that no, it's not happening. And if it doesn't happen, then again it sends the signal. So it becomes a cycle that it's not happening, therefore it's not going to happen again. If it's not going to happen again, that means there is a defect in me. No. Any psychological illness, let's say depression, let's say very high degree of stress, let's say serious psychiatric illness like bipolar disorder or schizophrenia. All these can affect our sexual performance. I would say in my practice, what I've come across is less patients who have physiological causes and more patients who have actually psychological causes, because there's a lot of pressure on us to perform. Now let's talk about the treatment of erectile dysfunction. The treatment comprises of, we need to understand that we need to check the hormones, we need to have an ultrasound done for penis, and we need to check whether a person is taking drugs or medicines or not. You will go to a lot of doctors who are going to tell you that okay, you need to take this little blue pill, half in quantity, for 15 days time or for a month's time. It doesn't work. Trust me, it doesn't work. You'll go to a lot of hakims, you'll go to a lot of homeopaths, you'll go to a lot of other doctors who are going to tell you this multivitamin is specifically made for this purpose, so try this. Trust me, it doesn't work. There has been no specific multivitamins or jari booty that has been made to help you with erectile dysfunction, unless there's a cause for erectile dysfunction and that has been eliminated. So my advice to you would be, you need to go to an ethical urologist and psychologist or psychiatrist. Psychiatrist who gives you time and who evaluates you in detail so that you and the psychologist can get into the depth and find out what is the actual cause and how to treat it. I'm not going to tell you the exact treatment because in our society the medications are available over the counter. So the best thing is to go to a professional, either a urologist who gives time or a psychiatrist who gives time. So this is all about impotence or ED. Let's keep it till here in our first part. In our second part, or that is our subsequent part, let's discuss about the other causes that is faced by men as far as the sexual health is concerned. Take care, because mental health matters.